Hey y'all, this is Deepu Gowda, Course Director for Foundations of Clinical Medicine Tutorials. Um, I just want to thank you for being a recruiter of patients for the course. Uh, I want to take a few minutes to describe the process of recruiting, and you'll get a chance to meet with us in person as well, to go over any questions that might remain. But I thought I'd take this opportunity to kind of give you a little bit of overview of recruiting itself. So the very first thing is I just want to thank you in advance for your time, your attention, your energy for being a recruiter. As you all know from your own experience in tutorials, being at the bedside is really the heart of the course. It's the heart of your clinical training, um, and having good patients to see either makes or breaks that experience. So your role is really critical to us having a successful course. Um, and we also know that it requires some real attention, real energy to make this happen well. So we thank you in advance for that. So you guys have signed up to recruit patients for us. The course occurs on Monday afternoons and Thursday afternoons. So, more or less, not quite half the class, but almost half the classes on Monday, a little more than half the classes on Thursdays. The recruitment of patients occurs the day before. So the recruitment occurs on Sunday afternoon or evening and Wednesday afternoon or evening. So when thinking about what patients that we want to choose, we in general want to keep several criteria in mind. We want to choose patients who are English speaking. We want to choose patients who are well enough to undergo a physical exam. So someone who's peri-intubation or someone who has acute abdominal pain, they will not be the appropriate patients. Um, and if you can, find out what's going on the next day for them when you recruit, because if they're going off for a major surgery, major procedure, major test, or if they're getting discharged the next day, they might not be the right patients, and so you want to eliminate those from your list. Um, Ideally, we would like to not have patients in respiratory isolation. So if they're being ruled out for TB, for instance, or even if they're on droplet isolation, if they have the flu, it's best not to recruit those patients. Um, However, we know so many patients are on contact isolation. Those patients are probably okay. So if you're having trouble recruiting enough patients, it is okay to do contact isolation. The team will get gowned up before they go in there, and that's totally okay. Um, and that's a good learning opportunity for the students anyway. In terms of what services to recruit from, totally okay to recruit from non-medicine services. And actually, we encourage you to do so because going up to the rehab floor on the eighth floor, going to neuro patients, going to surgery patients, uh, you might find some good patients there that will be able to give a good history, um, and are cognitively intact and who are not too sick. Um, so definitely check out those floors. So I think that will be helpful for you to do that. And also remember, we don't necessarily need patients that have the most exotic presentations or have the most interesting pathological findings. At this stage of their training, the students just need to be able to interview and examine someone who is well enough to be interviewed and examined, okay, and who's not going to be discharged or going off for a major procedure. In terms of recruiting from medicine services, most of your patients are probably going to be from medicine. So, you're going to be recruiting after hours on Sunday or Wednesday evening or afternoon. And you can identify these patients in a variety of ways. And I'm actually going to, in a few minutes, talk about some tips given by one of our previous recruiters, Sarah Godfrey. She made out a really nice handout that I'm going to share with you all about that. Um, and so she's going to have some additional tips. But in general, speak with the medicine residents. Hang out on 6, Garden South. That there's a medicine lounge there. Just drop in, ask them. Hey, I'm working for the tutorials course, recruiting patients for the physical exam course. Do you have any patients on your list that might be great for, doing an interview or physical exam with? Speak with the nurses. You might actually pull up resident lists. So if you go into Eclipsis, you can pull up the internal medicine teams, Gen Med 1, Gen Med 2, Gen Med, 2B, etc. Senior medicine, hospital services. Pull up those lists and kind of scroll those patients. When you go to those lists, you can make a handoff document. That's a neat and tidy way to kind of quickly scroll through who those patients are, and easy to identify the patients that you think may be appropriate. In terms of thinking about those teams, for internal medicine, the hospitalist teams are a great place to start. Those are patients, essentially, they need to be admitted, but they're not so sick that they need to be on a Gen Med team. So it might be a patient that, is a level 2 ACS, level 3 ACS, someone with a community-acquired pneumonia, someone with, DKA that's now, closed their gap and is doing well. Those are the types of patients that will go to the hospitalist services because they're just managed by one attending and one PA. So kind of already they've done a selection for you about the least sick patients that are being admitted. Go to Senior Med. Those are also good lists. And then go to obviously the Gen Med teams. Cardiology teams are excellent as well. So there's many different ways of identifying patients, and you're going to find a strategy that works well for you. But as a last resort, you may need to kind of walk from room to room as well. We've definitely had recruiters who've had to do that when they've not been able to recruit enough patients. So how do you actually get consent? So when you go into the room, this is totally verbal consent. All you have to do is kind of, when you've identified a patient that might be a good one to work with, you go in the room, you introduce yourself and say, hey, I'm a medical student, and I am part of the physical exam course for the medical school, where we teach students how to talk to patients and how to examine patients. And I've got a couple students that I think would really benefit from talking to you and examining you tomorrow afternoon. Would you be open to that? That's all you really have to say, and see what the patient says. And most of them will say, yeah, that sounds fine. What time do you think you'll come by? And you can say, well, they'll probably come by around 2:30, and they'll probably be with you, for about 45 minutes or an hour max. But I think you're going to enjoy meeting these students, and I know that they'll learn a lot from you. So you want to sell it a little bit, but obviously don't be coercive. But I think that's plenty enough detail for most patients to be able to say yes or no or tell me more. Now, as you guys split up your dates, you will be splitting up Sunday and Wednesday dates. I encourage you guys to have a mix of both, because the reason I say that is because we typically have more faculty on Thursdays. And so the person going on Wednesday is going to have a slightly bigger recruitment goal than the person that's going on the Sunday night. So if you kind of mix them up, it kind of balances out the effort over the course of the semester. In terms of the number of patients to be recruited, let our office kind of guide you about the absolute number, but essentially the day before the recruitment, you guys will get an Excel sheet from us that will have pre-populated the names of the preceptors that are going to be working on the day that you're recruiting for. And for each preceptor, there'll be 3 slots. So they'll have 2 patients that you'll recruit, as well as 1 alternate patient. So basically, per preceptor, there'll be 3 patients. In addition, we generally ask for up to 10 alternate patients in addition to those 3 per faculty. And we'll have a little section on the Excel sheet at the bottom of the sheet that says additional alternates. And the reason why we have this structure is basically we email out this list to the faculty members. They look at the list in the morning. They stop by the rooms typically around 1:30 and say hello. Even though you've already vetted those patients, there are some times when a patient says, no, I'm not feeling good today, I don't want to be interviewed. Or they may be off for a test, that we didn't anticipate or they didn't tell you about. So because of that, the two that are assigned to the faculty member, one of them or even both of them might not work out. So we've gone ahead and assigned one dedicated alternate for each faculty member. And if that one also doesn't work out, then they can go down to the lower pool of alternates to see additional patients that may work out for them. Right? So basically, if you're recruiting, just be on a lookout for an email from us that tells you, basically how many patients to recruit for that day. In terms of actual time it takes, the previous recruiters have said you need to set aside anywhere from 3 to 5 hours. So this is definitely a big chunk of time that you want to set aside to be able to do this. And the quality of your recruitment matters a lot. So we want you to take your time and get the right patients so that the students have a great experience. When you do start to identify patients, we want you to add those patients to a INYP list. So if you're on Eclipsys or if you're on INYP.org, as you know, you can pull up a list of services. There's a service that we've created for our course called Foundations Clin Med. And as you go into that list, go ahead and clear out what's there previously, and you can add to that list. Another kind of pro tip for you is look at that list that's already there, because there may be patients that have agreed to be examined from the previous session. Especially if you're going on a Thursday, look at the Monday list. There may be patients that are still in the hospital, and those might be patients to actually go to because they may have already worked out the previous, just a few days ago. So that might help you kind of rapidly populate that list in the very beginning of your session. But essentially, if you're not going, once you have a final list, you will remove patients that are not on your final list for that recruitment day, and you'll add any new patients. The reason we ask you to do this is because if you're recruiting on a Sunday night, let's say, the next morning what you'll do is you'll actually bring up that list again, and you will double check the room assignments because overnight patients might have been moved, overnight patients might have been discharged, etc. So you're going to do a final double check of the room assignments on the morning of, and you will finalize that list in that way. And if you already have it in the INYP or Eclipsys list, it's very easy to look at the room assignments in that way. Okay. So what happens on the morning of? So you have that Excel sheet. So what you're going to be doing is, let's say there's 10 preceptors. Each preceptor has 3 slots next to them. What you're going to do is you're going to take your list of patients and you will assign patients to your faculty member, each faculty member. And we want you to choose patients that are geographically proximate to one another. So for instance, if you have 2 patients on 7 Garden South, great. Those are 2 patients that go to one preceptor. It's nice if the alternate is also geographically close. If you can't be exactly close in the same quadrant, then try to stay on the same Garden versus Hudson side. So you might have one 7 Garden South and another patient on 7 Garden North. That totally works. All right. So you're going to go ahead and fill out the Excel sheet with the patient name, with the MRN, as well as the room location. The MRN, you can decide whether that, if it takes a ton of time, that's probably less important. But the name and the room number is really important because the faculty member should be able to go to that room and identify who the patient is and talk to them, because they're not going to be getting onto Eclipsys or any of our EHRs to find these patients. They're going to rely 100% on the sheet that you create. All right, so You're going to basically fill out that list, 3 per faculty member and the additional alternates. We're going to tell you how many alternates we need. It's going to be up to 10 additional alternates at the bottom. And then you're going to email that Excel sheet, and you're going to use a subject line that says hashtag encrypt patient list. And you're going to email that to Sarita Martinez, who is the manager of the fundamentals curriculum. She will be filling in as our go-to person until we get a permanent coordinator. And that's essentially it. Your job is done at that point. You've recruited the night before. You've double-checked the locations the day of, made sure that you've updated any new rooms, eliminated patients that might have been discharged, populated the Excel sheet with the names and the room numbers, put in the alternates, and you've emailed it to Sarita Martinez, and you have CC'd me. You CC'd the leadership, me and Dr. Kessler. So this is just some tips on how you're going to look up that list on INYP. Most of you know how to do that. This is just a screenshot of what that list looks like. And as you can see here, here's the foundations of ClinMed. Okay, and it'd be nice for you guys to email that list to us by 9 a.m. so we can get that out. Let me just quickly go over some tips that Sarah Gottfried, put together. And this is her approach. And I have to say, her approach worked really well because we had a lot of good feedback from faculty members. When you do send out that list, I encourage you guys to include all of the patient recruiters on that list. Just so everyone knows what patients you're recruiting. And what we are going to do the morning of, I forgot to tell you this, what we're going to do on the morning of is email the lists to our faculty members. And we're going to CC you guys on that list. And what we're going to say to them is, here are your patients for the afternoon. If you have any feedback regarding patient recruitment, please reply all. And what that does is it allows there to be a feedback loop for you guys, so that if you recruit patients and, Dr. Smith gets, 3 patients assigned, but none of them, work out because they're too sick or they're going off for a test or they're discharged, they can get that feedback to the whole group by replying all. So we BCC the faculty members, but we CC our core team, so that when they reply all, it'll basically come to our core team, including all the recruiters. So you guys get a chance to see, your recruitment strategy and how it's working. And that might be a great way to kind of provide that feedback for you guys to see how you can continue to tweak your practice. So Sarah Godfrey's tips, she used to print all the lists from the units on floor 5 to 9, excluding the ICUs. She would eliminate patients on respiratory isolation. I think it's okay to include contact. Then she would scan the chief complaints. If she had a patient that had AMS, failure to thrive, alcohol withdrawal, psychiatric illness, dementia, exclude those. And then she would kind of go floor to floor. I think that is definitely a strategy that she used. You might be able to apply it as well. And then when she got to the units, she would talk to residents, she would talk to the PAs, talk to the nurses. I also strongly encourage you guys to start with the hospitalist lists and start with the senior med list for medicine, because you're going to get the least sick patients who are pretty straightforward. So I think it's a great list to start with. She has some nice tips here about approaching patients for consent. You can take a look at that. This whole document is going to be available to you. Also, we'll email this to you, so don't have to memorize what's on this video here. She talks here about making your list as well, and some tricks and tips. Cardiology and cardiac surgery, high yield, onc and general surgery, high yield, neurosurgery and rehab, high yield. Check out McKean, check out Area E, because patients may be hanging out there for days. And if a patient is in Area E and you're recruiting on Wednesday evening, and you think, hey, this is a good patient, and you check the next morning, the patient may already have a bed. So just update that. If you end up recruiting an Area E patient, just know that obviously they're on the launching pad to go up to a floor. So just check the location the next morning. All right. Here's a few more tips. She says sometimes it'll take 3 hours, sometimes it'll take 6. Be prepared. So those are, hopefully this video is helpful to you. You're going to meet with our team, so you have a one-on-one experience with us so you can have your questions answered. Be in touch with our administrative staff to make sure that all your paperwork is in place so you get paid. We've had some delays in the past paying people, and honestly, most of those delays have been because there just has been some paperwork that someone forgot to fill out, like a recruiter forgot to fill out, or something like that, that can happen. So just be on top of any logistical aspects of the payment process on your side, and we will do our part to make sure you get paid on time. But thank you so much in advance for your time and energy in helping to make this course outstanding. And we hope that you enjoy meeting all your patients and know that you're serving your fellow students by this role. And during this, role, if you want to do any kind of scholarly work with us, if you want to get involved in medical educational scholarship or teaching, we welcome that as well. Okay, thank you all.